Hello, my name is Dr. Alex Martin. I'm the medical director at PureCell New Life Solutions. Today I would like to tell you some more about our new developments in cellular biology. Many people ask me why stem cells cannot be used to cure cancer. The problem is the stem cells are very immature, undifferentiated, and that's why we like them. As a result, they cannot recognize bad cells like cancer cells. They have no ability to detect the markers on the surface of those bad cells. So it's important to know this and to realize why the stem cells cannot help in cancer treatment. We know that there are three marketable types of stem cells which are available now. There's the stem cell from the fetus, there's stem cells from MSC, which comes to the placenta, and the third type of stem cell is from fat transfer or from liposuction. We use MSC, that's mesenchymal pluripotential stem cells, because they are the best. We know that they work and they're easily obtained and they're fresh, and we have frozen varieties as well. So the fat cells, derived stem cells, are not effective because they have already started down the path of differentiation. They've already become the organ that they're targeting. So they're not as effective as the MSC cells. The fetal stem cells are unreliable and difficult to obtain. People ask me many times, well, what can the major stem cell type we use, what can it do? The mesenchymal pluripotential stem cell, we call MSC, is very, very useful. It's the heart of our stem cell practice. We use it often to inject into joints, to repair torn cartilage in the knees and shoulders and hips. We also use it many, many times to repair tendons and soft tissue injuries where muscles have been injured or tendons and ligaments have been injured and need repair. Other times we use it for diseases of the skin, so that it's useful in repairing skin disease and scar tissue as well. Now we're using stem cells of this type, MSC, also for hair loss and to regenerate hair. So there are many, many functions that we are discovering every day for MSC type cells. Patients ask me many times about their conditions. Can you treat me, doctor, with stem cells? I always am very careful to take a history from the patient to identify what the problem is. If it's a joint problem, shoulders, knees, hips, many times we look at the MRI and we can see, like a roadmap, what to treat and where to treat. Other times, if the patients are diabetics and they want the diabetes treated, that's something that's more complex. And we have research programs which have dropped the blood sugar significantly with stem cells, but it's not a mainline treatment yet. It's approaching that point. We have good data now. Other therapies for other problems, for example, Parkinson's disease and neurologic problems, are not treatable at this point because we can't get to the cause with stem cells. We need to be able to transfer stem cells directly to the area affected. And many times the big problem in neurology is getting to that site. Patients ask me about their hair loss. Can you help me with using stem cells to stop my hair loss? The answer is yes. We have used for the past decade platelet-rich plasma, which is another blood product from the serum, to stimulate hair follicles to regrow and restore themselves. Now, we are using stem cells, the MSC stem cells that we spoke of earlier. That's very important because it stimulates the hair follicles to produce new follicles around it, using the old hair follicles as a template. So anytime you have questions about hair loss, we're here for you. Don't hesitate to contact us. Many of our male patients ask me about how to treat erectile dysfunction with stem cells. We inject stem cells in targeted areas in the penis where there's a vascular junction. The stem cells enter the arterial circulation and venous circulation, and they correct the dysfunctional blood flow. They open up channels again. So it's really quite useful to use stem cells for that purpose, and the data shows now that it's very successful. You may want to know how long stem cells last. The answer to that question is it depends on the damaged area. We can see from an MRI or an X-ray and make an assessment as to how much damage is done. Then we can tell you, well, you need 60 million, 250 million. The shoulder and the hips, for example, are quite different. The shoulder may require only 100 million to do the job properly, and we'll inject that much into a ligament injury. The hip, however, is much larger, and it may require much more, maybe 200 to 300 million stem cells to repair the cartilage in the lining of the hip, which is quite large. So it all depends on the damaged area and what the data shows up on the MRI and X-ray. Another question is, how long will the stem cells last? The answer to that question is, once the stem cells are injected, they replicate, meaning they multiply in great numbers, and they attach themselves to the damaged tissue. Then they become that tissue. So sometimes one injection is enough. Other times it takes 3 to 4 injections over a certain period of time. This again depends on the area that's been damaged and what the data shows up on the MRI or X-ray. Many people come in once or twice a year for stem cells just to have a treatment because they want to maintain their liver, or they've had a history of hepatitis in the past. Or they want to maintain their kidneys, and they don't want to have dialysis in the future. So we do see patients who travel a great distance from China and from Europe to see us because they want to maintain their body and live longer. It's a way to delay damage and repair damage from, we have so much from toxins in the environment, cosmic rays, radiation, poisons, pollution, bad food. I mean, there's a lot of damage occurring in our body just from the impact of all of these things. So the stem cells can mitigate that. They can help that in many ways to repair maybe 25 to 30% of the damage. So we don't live forever, but it's a good way to extend life. You know, like you said, 120 would be nice, 110 if we can, you know, maybe longer.